Welcome to the Child Welfare 101, created for Community Developmental Disabilities programs, brought to you by a partnership between the Office of Developmental Disabilities and the Oregon Department of Human Services. What does child welfare do? The Child Welfare Division's mission is to ensure every child and family is empowered to live a safe, stable, and healthy life. The vision for transformation is based on a belief that children do best growing up in a family and on values related to honoring and supporting cultural wisdom, building community resilience and voice, and ensuring the self-determination of our communities of color. For more information on the vision for transformation, you may click on the link. For the Oregon Department of Human Services Child Welfare Division, all programs operate by what are called districts. There are 16 districts, which cover each county in the state. Within the districts are branches in which local office staff focus on the delivery of services. Additionally, there is a central office which oversees the operational side of the work. When partnering with child welfare, you will likely be working with a staff in a specific district local to your county. Check out the map now and see which district is in your area. Here is a list of roles that the CDDP may come in contact with. Learn about each of the roles and their responsibilities. ORCA. Screeners take calls of reports of abuse and neglect. Screeners determine appropriate levels of response and initial interventions. Safety, or CPS. Child Protective Service caseworkers investigate reports of safety concerns. This includes conducting child safety assessments of alleged child abuse or neglect, evaluating whether a child has been or is currently at risk of being harmed, and, if needed, determining appropriate services to ensure child safety. Permanency. Permanency caseworkers specialize in working with children, families, resource parents, and community partners to ensure children are safe in their homes. This includes ensuring a child's physical, psychological, and social well-being with the goal of reuniting families or finding alternate, permanent plans when necessary. Adoption. These workers may have other titles depending on the location, or they may be the permanency worker assigned to the case. Their role is to work toward legal adoption of the child if that is what the current permanency plan and court order is. Certification. Certifiers work to identify and certify relative resource parents, non-relative resource parents, and adoptive parents across all ethnic and cultural groups. This work includes home studies, interviewing and evaluating appropriateness of substitute care placements, and ensuring children are able to live safely when not able to be safely at home. Residential Resource Coordinators, otherwise known as RRCs. These folks will be the individuals responsible for referring children to Behavioral Residential Treatment, or BRS services, if that is what the child has been found to require based on their individual treatment needs. You may also come in contact with a CASA, or Court-Appointed Special Advocate, and the child's attorney. These individuals are legal parties to the case but not employed by the Oregon Department of Human Services. If you are ever in a situation where you have reasonable cause to believe that child abuse or neglect has occurred, please call the Oregon Child Abuse Hotline, otherwise known as ORCA. Even if you know the child or family in question is already working with child welfare, mandatory reporters are still required to call into the hotline. What happens after a call is made to the hotline? From the time ORCA receives the call of concern, there are two outcomes. Closed at screening means the case will not be assigned to anyone for review, but the concern will remain documented. Assigned means a CPS worker in the local district to the family or child will respond within the time frame assigned. Timeframes range from immediate, within 24 hours, to 10 days, depending on the nature of the call. This decision is made by ORCA. Once assigned, a comprehensive CPS assessment will be completed. If the child is found to be safe using the Oregon Safety Model criteria, the assessment will be closed and no further action will take place. If the child is determined to be unsafe, plans to manage or mitigate the safety threat will occur. There are 16 specific safety threats used to guide the worker and family in understanding the needs at hand and what will have to occur for an in-home plan with parents to be approved or for other care to take place. Once the safety threat is mitigated, meaning it no longer exists due to a variety of protective factors, the case will close. There are times when safety cannot be managed or mitigated with parents, which will lead the agency to determine other options, including relatives and non-relatives. As each case is so specific to the needs and circumstances in the family, please confer with the caseworker assigned for questions on what to expect. Here are some settings children may reside in. Please note, the priority of child welfare is always reunification with parents and legal guardians, or relatives if possible. Resource homes are what child welfare calls foster care. BRS services are treatment and are meant to be short-term with a plan to place the child back in their community. Self-selected environment is not a placement, and efforts have to be made continually to find a placement. Temporary lodging is not a placement, and efforts have to be made each day to find a placement. Independent living is only approved for some youth or young adults. Mental health or other medical treatment is meant to be short-term with a plan to return the child to their community. These services are not referred or approved by child welfare, but rather a psychiatrist, the coordinated care organization, or other medical providers. Please take time to review the different types of meetings or events that are examples of opportunities for the CDDP and child welfare collaboration. There may be additional examples depending on your situation, so please note this is not an exhaustive list. Ensure you are being invited to the important meetings to support the child. Here is a list of helpful links and resources you may want to save for reference in the future.